How you doing, everyone? Welcome to anatomy tutorial number 4. Today we're going to talk about movement terms and planes of motion. As usual, the content that is in this tutorial builds upon the content that was delivered in anatomy tutorial number 1, 2 and 3, so please make sure that you are familiar with that content before you progress on to this new content. This video will be slightly shorter than normal because we're just going to go through some definitions and illustrate them with pictures. However, there is an accompaniment video for this tutorial that you should watch afterwards, and that video brings the movements to life with videos illustrating each one. But first we'll go through the different terms and find out the details that you'll see covered in more detail in the second video. So remember that when we are talking about movement, we are talking about movement from the anatomical position. So the anatomical position is standing upright with the feet about shoulder width apart, hands down by your side with your palms facing forward, head in a neutral position with the eyes looking ahead. So from the anatomical position, flexion is any movement that results in the decrease of an angle about a joint. Opposite to that, we have extension, any type of movement that results in the increase of the angle about a joint. So they're pretty simple concepts. Flexion results in the decrease in the angle at a joint, and extension results in an increase in the angle at a joint. So if you see my arm now, I know this is not the anatomical position, but just because of what I can fit into the video there. If we look at my arm, so my arm is straight at the elbow joint, so we've got an angle of approximately 180 degrees, a straight line there. If I were to bend my elbow, I am decreasing the angle at that joint. Now we've got a 90-degree angle at that joint, so it's gone from 180 degrees, open here, 90 degrees here, so the angle at the joint has decreased, so we would say that that elbow has been flexed. That is flexion. And then opposite to that, we have extension. So if we go from 90 degrees back to 180 degrees, we have increased the angle at the joint, so therefore that is extension. Flexion decreases the angle, extension increases the angle. We also have an extra type of movement there called hyperextension. Hyperextension is any movement that results in an increase in the angle at a joint beyond the normal anatomical position. Now, I am not double jointed, so I can't hyperextend my elbow. Some people can, where you'll see that they can extend their elbow beyond the normal anatomical position, but more usual here if we were to talk about the shoulder joints now. So again, if you were to picture a straight line up through my shoulder joint here, we've got about a 180 degree angle, a straight line here. If I bring my arm up in front, we have taken that straight angle and turned it into a 90 degree angle here. So that's flexion of the shoulder joints. If I extend my arm back down to the anatomical position, that's extension. And if I bring my arm behind me, I'm now hyper extending the shoulder joints. So flexion brings the arm up in front of you, extension brings the arm back down to the anatomical position, hyperextension brings the arm back behind you. Obviously that occurs the hip joint as well. So if you think about your hip, if you were to kick a football, in order to kick that ball you draw your leg back behind you, hyperextension, and then flex your hip as part of the kicking movement. Just a further example there, flexion and extension of the knee. So flexion is decreasing the angle at the knee, extension is increasing the angle at the knee. There's our examples of hyperextension, extension and flexion at the hip, hyperextension, flexion and hyperextension, extension and flexion at the shoulder joint there. This line here is just to illustrate that straight line going through the shoulder joint, where we've got an approximately 180 degree angle at the shoulder. If we flex the arm up here, we see that we've now moved to 135. So from 180 to 135, that is decreasing the angle, so it is flexion. We can also see examples of hyperextension, flexion and extension at other joints around the body as well. So what we are referring to is an increase or a decrease in the angle relative to the normal anatomical position. There's also a different type of flexion known as lateral flexion, which is a sideways flexion, typically of the trunk or neck away from the midline of the body. So we can see here this guy is laterally flexing his trunk. So that's a kind of a movement that is occurring at all of the joints up along the vertebral column at once. It's not a single joint like your elbow or your shoulder. That's movement that is facilitated by movement at multiple joints all along the spinal column there. Lateral flexion, sideways flexion of the trunk or the neck away from the midline of the body. Horizontal flexion and horizontal extension are movements that result in the decrease in the angle at a joint in the horizontal plane. So if you were to flex your shoulder, so it's up out in front of you like this, and then if you were to keep it in that position and move it out to the sides and move it back in, we are horizontally extending the shoulder and we are horizontally flexing the shoulder. So it's flexion and extension in the horizontal plane, so parallel to the horizon. Abduction and adduction, another pair of movement terms. Abduction is movement of a body part away from the midline of the body. So an adduction is the opposite. It is moving it back towards the midline of the body. I just remember that if you abduct someone or something, you are taking it away, so moving it away from the midline of the body. And adduction is like you are adding it back to the body. So abduction is taking something away from the midline of the body, and adduction is movement of a body part back towards the midline of the body. Obviously we can see it occurring at the shoulder and the hip joint there, and it also occurs at other joints around the body, but the main ones you're going to come across there are abduction of the hip and shoulder joints. There's other further examples of abduction and adduction. Circumduction is a specific combination of movements that results in a body segment moving apparently around in a circle. It is moving around in a circle, but what's actually happening is a combination of flexion, abduction, adduction and extension. So if you were to put your weight onto one foot, hold one leg out in front of you and make a circle with your leg like that guy is doing in the picture there, what you're actually doing is flexing the leg, you're abducting it, you're adducting and extending it to move it around in those in that circular shape. So it's that circle motion is generated by a combination of flexion, abduction, adduction and extension. And obviously that can occur at the shoulder joint. Making arm circles there is possible at the shoulder and the hip joint there. Ball and socket joints, so they allow a good degree of movement. We'll cover them in more detail in a later tutorial. Rotation is a pivoting or twisting movement, and rotation can be broken down into medial and lateral rotation. Medial rotation is when something rotates towards the midline of the body, and lateral rotation is rotation when something moves away from the midline of the body. So again, like in the image there, if you were to hold your elbow down by your side and put your hand out in front, if you turn your shoulder joint so that your arm is laying across your tummy, you have rotated your shoulder joint inwards. Your humerus has rotated towards the midline of your body in the shoulder joint, and from there, if you're to bring your arm back out to the side, that is lateral rotation. It is movement away from the midline of the body. It can also occur at the hip joint, and it can occur at the neck as well. Medial and lateral rotation are sometimes called internal and external rotation as well. So medial is internal rotation, something towards the middle or the inside. Lateral or external rotation is movement away from the midline or towards the outside. Elevation and depression. Elevation is the raising of a body part to a more superior position. So the examples is your shoulder blades, shrugging your shoulders, pulling them up to a more superior position, and depression is lowering a body part to a more inferior position, so dropping them down. So from the normal anatomical position you can depress your shoulders, put them down, or from the normal anatomical position you can elevate your shoulders, pull them up. As we speak, our jawbone, our mandible, is elevating and depressing. It's moving up and it's moving down. We can also, specific to our shoulder joints, we can protract and retract. Protraction is the forward movement of a body part. We can pull our shoulder blades forwards. Retraction is movement of a body part backwards. We can retract our shoulder blades. So we can protract and retract. We can also protract and retract our jaw. We can push our mandible forward, or we can pull it back in. Two specific type of movements around the ankle are plantar flexion and dorsiflexion. Plantar flexion is moving the top of the foot away from the shin, or more commonly just pointing your toes down towards the ground. So as you point your toes down, that specific movement is called plantar flexion. I'd like to think, just remembering it, if you're trying to plant your foot into the ground, you're going to point your toes down into the ground. And dorsiflexion is the opposite of that. It's moving the top of the foot towards the shin or raising the toes up. Plantar flexion and dorsiflexion. Supination and pronation, again another pair of movements. Supination of the hand is movement so that the hand faces upward or more forward. So when we are in the anatomical position, the palm of the hand faces forward, so we say the hand is supine. If we turn our hands so that their palms are now facing behind us, we say the hand is now pronated. It is in a prone position. So supination is moving something so that it is face up. Pronation is moving something so that it is face down. When we're referring to the body, you'll often come across those positional terms, supine and prone. So supine is the body laying face up. If you're going to do a sit-up, you are lying in a supine position. And a prone position is when the body is lying face down. So if you're going to do a press up, you will be in a prone position. Supine, face up, prone, face down. Now, the last thing I want to cover is linking those the planes of the body that we talked about in tutorial number 1 to movement planes. So, quick recap, we said the sagittal plane divides the body into left and right parts. That is the red cards that we can see passing through the body there. Specifically, the mid-sagittal plane divides the body into equal left and right parts. Movement in the sagittal plane occurs around the transverse axis. So we said the transverse or horizontal plane is one that divides the body into upper and lower parts. So movement that is parallel in the sagittal plane. So if we think about a bicep curl, if that person here is standing, if they have a dumbbell in their hand and they're going to do a bicep curl, that movement is going to occur in the sagittal plane because it is parallel to the sagittal plane. And at the elbow joints, we have the elbow flexing around the transverse axis. So the axis that the elbow is rotating around is the transverse axis, and the movement is occurring in the sagittal plane. The frontal or coronal plane divides the body into front and back parts. Movement in the frontal plane occurs around the sagittal axis. So if we think about shoulder abduction in the frontal plane, so that is moving your shoulder away from the midline of the body, like a lateral raise exercise that you would do with a dumbbell in the gym. That movement occurs parallel to the frontal plane, and it occurs around the sagittal axis. So if this arrow was passing through the shoulder joint there, that would possibly be a little bit clearer. The shoulder, the movement is occurring around the sagittal axis in the frontal plane. Finally, we've got the transverse or horizontal axis that divides the body, transverse or horizontal plane that divides the body into upper and lower parts. Movements in the transverse plane occurs around the vertical axis. So that one's kind of easy to understand. As you rotate your head to say no, that movement is occurring in the transverse plane. It is parallel to the transverse plane, and it is occurring around a vertical axis. So they're the movement planes and axis of rotation. So if you wanted to really drill down and describe a movement in great detail, you need to understand these planes and axis. So going back to our lateral raise from the previous slide there. So a lateral raise, bringing two dumbbells up to either side like that. That movement is occurring in the frontal plane, rotating around the sagittal axis. And you can divide any exercise or any movement can be described in those terms. Okay, that's the end of the content there for this tutorial. Please have a look at the video that accompanies this tutorial where the specific movement terms are illustrated in more detail. Thanks for your attention. I'll catch you in the next tutorial.